Thank, thank you, Claire and team, for inviting us to host our very first annual virtual benefit education session for Wellpoint. We know that you guys are new entrances into the GIC. I'm Shayna Sullivan. I'm the account leader from the GIC, or for the GIC account from Wellpoint, and I'm joined today by Elaine Pedroza, who's our benefit expert. Our purpose today is to help inform and educate you about who Wellpoint is, what makes us unique, and our robust benefit offerings. As you know, annual enrollment begins on Wednesday, April 1st, and ends May 1st. We feel it's our obligation to engage with you and help you make an informed decision before annual enrollment while navigating through this complicated and sometimes challenging health insurance space, but hopefully making your experience easier. Just a couple of housekeeping items before we get started. We are only allowed to talk about Wellpoint. So the GIC does offer the other carriers, which I think they're invited, so you will be able to ask them questions. So we can only talk about Wellpoint. The GIC does also offer pharmacy benefits and other vendors as well. CVS, for example. We are not able to talk about any of the other vendors. On the agenda today, we have an overview, considerations when navigating your health insurance benefits, right? So how to pick the right plan for you, choosing the right Wellpoint plan for you, what's new for 7/1/26, wellness resources and digital virtual access that Wellpoint has to offer, and then where to find more information on Wellpoint. We know that there's going to be a lot of information being thrown at you, and we want to make sure that you know where to go if you have any questions afterwards. So again, I had mentioned that the GIC offers different vendors. So you can see highlighted here on the left, we are Wellpoint. We are one of four of the medical benefit carriers. So there are three others. Your employer may or may not offer the other vendors, such as dental or vision, through the GIC and may elect to use their own vendors. But I just wanted to show this on the screen. CVS Caremark and CVS Specialty definitely will be your pharmacy prescription coverage and specialty drug coverage. One question that often comes up is, can you use like another retail pharmacy? So Walgreens, for example. So the answer is yes. And again, any benefit questions for CVS would need to go through them, but I can tell you that you can utilize any retail pharmacy. And then effective 7/1/26, the FSA flexible spending accounts will change to Ameriflex. Just a couple of fun facts about who Wellpoint is. So number one, we are the only health plan that is dedicated to the GIC. So no other carrier under the GIC is actually dedicated to the GIC. We've served the GIC members for almost 40 years. So that just is a testament to the type of relationship that we have had with the GIC over the last almost 40 years. The other fun fact is people may not know who Wellpoint is, right? Well, Wellpoint is affiliated or sort of under the parent company of Elevance Health or Anthem Blue Cross Blue Shield. In the state of Massachusetts, Blue Cross Blue Shield is the insurance carrier for the private market, right? Wellpoint is specifically for GIC. Outside of Massachusetts, I'll take New Hampshire, for example, since that's the next closest state. New Hampshire, we actually utilize the Anthem Blue Cross market network in New Hampshire to provide you coverage. So that's essentially how our relationship works. Navigating health benefits for you. So these are important questions that we want you to ask regardless of what health carrier you're looking at. And they're just important, right? So where do you live? That's going to matter because you may not be eligible for every plan under the GIC. I'll give Wellpoint, for example. So Wellpoint offers Total Choice and Plus. As the subscriber, you can live in any of the New England states. Our Community Choice Plan, and I'll have these details a little bit later, our Community Choice Plan, as the subscriber, you must live in Massachusetts. So that just gives you an example. What doctors do you currently see? So this matters because a lot of people do not want to switch their doctors. They're comfortable with their doctors. They don't want to switch. With Wellpoint, because of the type of products that we offer, which is essentially an indemnity PPO type of plan, you're going to be covered in Massachusetts for sure. The reason why is we don't have a traditional network. So you really don't need to worry about switching your doctors with Wellpoint. Unless, of course, for example, maybe they might be a higher tier and you want to go to a lower tier, then that's an option. But as far as network goes, you wouldn't have to worry about that with Wellpoint. Are you comfortable electing a primary care provider? Well, we ask that because some people don't, want to pick a PCP. With a lot of the medical carriers, you're required to pick a PCP. With Wellpoint, you do not have to pick a PCP. It's strongly encouraged and recommended, of course, for continuity of care, and it's just a good best practice, but you don't have to select a PCP. Do you mind seeking referrals for specialist visits? We all know it can be a pain, right? You have to go to your PCP, you have to get a referral for a dermatologist before you book an appointment. With Wellpoint, you do not have to get a referral for any specialist visits. So you can just book an appointment and go to that doctor without getting a referral. Do you travel often? If the answer is yes, Wellpoint has a plan for you because we cover you when you travel. Do you have out-of-state dependents? So whether that's a child that's in college out of state or an ex-spouse, all of our plans cover your out-of-state dependents beyond emergency services. So they can get their regular routine visits, surgeries, et cetera, out of state. Do you need or prefer virtual care options? And I'll talk a little bit about our virtual care options, but if the answer is yes, great. Wellpoint has both behavioral health and medical virtual care options at some low telehealth cost copay to you. And then do you need prescription drug coverages? So just some questions to, consider. The next one, you'll hear a lot of lingo. Understanding basic healthcare terminologies is also very important. So I wanted to put this on the slide for you because you're going to hear indemnity, you're going to hear broad and limited, you're going to hear PPO and HMO, you're going to hear all of these terms. Well, what does it mean for you? So indemnity. Indemnity plans essentially provide flexibility to choose any provider and get reimbursed coverage for your medical expenses, right? All of our Wellpoint plans are considered an indemnity product and is actually the only GIC plan that offers indemnity products. Next, we have network plan options. So you have broad network. So broad network plans offer extensive provider choices, whereas limited network plans restrict selections to fewer healthcare providers. And Wellpoint offers both. The caveat to that, right? So you may see limited and freak out and say, oh my goodness, that means I only have a couple of doctors to select from. Well, for community choice, and I'll show this on another slide, community choice is our only plan that's considered a limited network. However, we have the largest network of hospitals. In addition to that, all of our plans are PPO. So even though it's limited, by having our plan set up as a PPO type of product, what that means is you get out-of-network care. Or coverage, right? You may have to pay a little bit higher out-of-pocket cost, but you don't have to worry about necessarily am I going to get stuck with a $5,000, $10,000 bill because I saw an out-of-network provider? All of our Wellpoint plans are a PPO type of product. So that gives you more coverage and more flexibility. HMO plans, which Wellpoint does not have, requires in-network providers, so they don't have out-of-network coverage, and they require you to get a referral. And then I'll skip the other one. There's regional, which is basically just a regional-based product, which Wellpoint does not have. So what else makes Wellpoint different? So again, no referral needed. We have some of the lowest premiums. And I always point this out because, you may see like a $5 cost difference on a premium, right? And you may just solely be looking at what can I get at the lowest premium? Well, let's say one of our products is $5 more expensive than another product. Well, I can assure you that you're going to get a lot more. And what I mean by a lot more is you're not going to have to worry, at least in the state of Massachusetts, if you get seen out of network. If you do, you're covered. It might be the 80/20 benefit, but you're covered. So if you get hit with another carrier getting seen out of network, you're going to get hit with a large bill. That's going to wipe out any potential savings that you saved on the premium, right? And then some. So just look at that difference. WellPoint offers a lot more coverage. No PCP. We have broad access to BH services through our sister company, Carelon, and then travel anywhere. High customer service satisfaction. So a lot of people love WellPoint. Our customer service satisfaction is 95% year over year. And the reason for that is our customer service really takes the homework out of the member. We try to not have you as the member go and do any homework or research. We do that for you to resolve your issue. Access to more medical care across Massachusetts, lower telehealth cost share, 100% durable medical equipment coverage. So we're the only plan that covers 100% of your DME. And then cancer screenings. So we have a plan that's designed to meet your needs at every stage of life. And again, I'll continue to educate you on our plans, but this is just kind of the start of it. So Community Choice is the lowest premium product on the shelf. This one offers you good benefits at a lower cost, while still giving you convenience. So it's a really good value. And I'll talk a little bit about those nuances in a few, but it's a really good value. A lot of people select Community Choice because it is a lower premium product. We do have what's considered non-community choice and community choice hospitals. That is our limited network, but it's still a really great value that offers you still a lot more flexibility than some of the other carriers. Plus is our most popular. So it's a little bit higher in the premium, but it is, you're getting a lot more flexibility in the sense that all of the providers, especially in Massachusetts, are in network. It's just tiered. So it's going to be a tiered product where it's tier 1, tier 2, tier 3. And then you have Total Choice. Total Choice is more expensive. It's like our Cadillac product. And many people who select this are people who have a lot of chronic conditions. They get seen at the doctors very frequently, or maybe in and out of the hospital, or have dependents that are in and out of the hospital. And this one just offers sort of peace of mind. And again, I'll show this a little bit later, but the reason why is because you have one flat copay for your PCP, one flat copay for your specialist. You don't have to worry about what hospital they're at. If it's tiered, that sort of takes all of the thinking out of it. And then we have Medicare Sup, which is our Medicare supplement plan for retirees, but you must be Medicare eligible. Okay. So again, deeper dive into our product offerings. So Total Choice, I mentioned earlier, depends on where you live, right? So this one is offered to subscribers residing in New England. So Connecticut, Maine, Massachusetts, New Hampshire, Rhode Island, Vermont, and outside of the US. So if you are fortunate enough to live outside of the United States, this is actually the only plan that you can pick within the GIC. And I know we talk about subscribers where you live. There are many people that are snowbirds, right? May live in Massachusetts, but also live in Florida for 5.5 months out of the year, and they commute back and forth. You can still elect any of the plans so long as your address on file matches what our geographic coverage is. So for Total Choice, if your residence on file is New England, but you still travel to Florida, that's okay. You can still pick one of our plans. So Total Choice is an indemnity broad network. So again, you can see any provider without referrals, no matter where you get your services. There's no difference in your out-of-pocket costs. For Plus, again, the same thing as Total Choice. Subscribers must reside in New England. You just can't live outside of the United States. Indemnity broad network. It's a PPO type of network. So what that means, again, as I mentioned, in the state of Massachusetts, we don't have a traditional network. Regardless of where you go, you're going to get the in-network benefit. Okay. The contracted, non-contracted only comes into play outside of Massachusetts. So any state that's non-Massachusetts, you're still covered for a non-contracted or an out-of-network provider, just at the 80% benefit. So that's a really huge distinction to understand. Community choice, again, this is for subscribers residing in Massachusetts only. So if you reside outside of Massachusetts, you cannot elect the community choice plan. Does not include Martha's Vineyard or Nantucket. It's an indemnity product, but limited, as I mentioned earlier, still functions like a PPO plan. What I mean by that is we have a network of 56 hospitals in Massachusetts, including your large hospitals like Dana-Farber, Boston Children's. It actually has the largest hospital network amongst the GIC carriers. If you were to go to a non-community choice hospital, for example, for outpatient surgery or inpatient elective admissions, they're covered at the 80%. Diagnostic services require copays of $50 per visit for labs and x-rays. So that just gives you an example of how the benefit would work if you were to go to a non-community choice hospital. And then we have Medicare extension. So this is for Medicare members living anywhere in the US. You must be enrolled in Parts A and B. You can see any doctor or hospital in the US as long as they're contracted with Medicare or enrolled with Medicare. The plan really provides additional benefits beyond Medicare. So we include coverage like hearing aid and eye exams. And effective 7/1/26, our Medicare OME product will actually be the lowest premium Medicare supplement product offered through the GIC. So it's really a win-win because you get really great benefits above and beyond Medicare, really great benefits compared to the other supplement plans at a lower premium. So I know I talked a lot about the different plans. This is sort of how they compare for Total Choice plus Community Choice. You can see the dollar range, but you can see for all of them, no PCP required, no referrals. You can travel anywhere. You can see any provider. You can live in New England for Total Choice and Plus, and then Massachusetts for Community Choice. And then the hospital structure is just is where it differs. So Total Choice, any hospital, Plus, still any hospital, it's just tiered. And then Community Choice, it's participating or non-participating. And then your dependents are covered anywhere. This just gives you a snapshot of your out-of-pocket cost by plan. For your deductible for Total Choice and Plus, it's going to be $500 for an individual plan, and then $1,000 for the family plan. For Community Choice, it's going to be $400 and $800, and I think $400 and $800 is the lowest that it goes for all the carriers. Your maximum out-of-pocket cost for individual is going to be $5,000 and $10,000 for family, and that's across the board. Your PCP visits for Total Choice. So remember, I mentioned flat copay. It's going to be $20 regardless of where you get seen. Doesn't matter for PCP. Specialists, same thing. It's not tiered. It's going to be $45 flat regardless of where you're seen. And then telehealth, $20 per visit. Your plus, this is where it's tiered. So it's going to be 10, 20, 40 for your PCP. Tier 1 is going to be the lowest. Tier 3 is going to be the highest. Specialist, it's going to be 30, 60, 75. And then $10 for your telehealth. For Community Choice, you're going to have a $20 copay for your PCP regardless of where you get seen. And then Specialist, it's going to be 30, 60, 75. And then 20 for telehealth. So hopefully this just gives you a better snapshot and understanding of what some of your out-of-pocket costs would be. For Medicare extension, again, lower cost. As I mentioned, it will be the lowest premium for the Medicare. $10 office visit copays versus $15 for the others. Behavioral health, your first 4 visits are $0, and then it's $10 for in-network behavioral health providers thereafter. Chiropractic, it's $0, even beyond Medicare coverage. It gives you flexibility nationwide, no referrals. Therapy, so PT, OT, speech, no cost to you. And then you still get your wellness, fitness reimbursement of up to $100. So again, I'm throwing a lot of information out there. This just gives you another visual of sort of the differences in Wellpoint's Medicare sup product compared to the others. So I'll just call out a few. Again, PCP, it's going to be $10, where some of the others is going to be $15. Your PTOT, it's going to be $0 versus $15 for some of the others. So this just gives you, again, a snapshot of the type of benefit that you'll get. What's new this year for 7/1/26? So there's really nothing new. There are no plan design changes for the medical carriers, so they're going to be the same as they are today. There is going to be a change to the pharmacy benefit. And again, this is under the CVS pharmacy benefit, not under the medical benefits. But the GIC did vote to remove GLP-1s for obesity, weight loss management only. It'll still be covered for the I think there's 7 FDA approved diagnoses, such as diabetes and sleep apnea. So if you have diabetes and obesity, you can have both comorbidities, it will still get approved. It just won't get approved if you're only seeking it for weight loss management. So wellness resources. A couple of our sort of pillars, right, are two things, keeping people healthy, but also getting people healthy. So one of the ways to that is supporting a healthy lifestyle through fitness reimbursements. It's a very underutilized reimbursement. To people. I don't use it enough. A lot of people do not think to use it, but we have the broadest coverage for fitness reimbursement options. So it covers you way beyond your gym, your health clubs, your fitness centers. So it covers you for boys and girls clubs, yoga, Pilates, spin, in person, online. If you have a Peloton and you do a subscription, it covers you for that. Dance studios, classes, martial arts, personal trainers, whether in person or online, sports teams. So if you have children that are enrolled in camps or sports, that's reimbursable. Organizations and leagues designed for fitness, hiking, bowling, that's reimbursable. So it's $100 for the individual plan and $200 for the family plan. Just some additional programs we like to call out. So diabetes reimbursement program we have, there's no exclusion. So whether you're diabetic or pre-diabetic, you can utilize this. We're the only plan that offers a diabetes prevention program. So you can get reimbursed up to $500 when you complete 20 or more sessions. All you need to do is just find a diabetes prevention program that's approved by the Massachusetts DPH, or it's offered through the YMCA if you live in any other state outside of Massachusetts. And there's plenty to offer. I did check the website and there's a lot on there. Tobacco cessation counseling. So we cover the cost of tobacco cessation counseling programs. Nutritional counseling, we cover the cost for any diagnosis, including diabetes, weight loss, eating disorders, new allergies, etc. There's no limitations for this. Comprehensive benefits for screening. So earlier on, I mentioned preventive screenings. Well, here you go. So there's no cost for preventive screenings. That's not new. That's for all carriers, should cover your annual preventive screenings and your BH wellness exams. But we've taken it a step further where we do not have any age or frequency limitations for the following screening services: mammograms, colonoscopies, lung CT scans, or prostate exams. We're the only plan that does not have these limitations. And the reason for that is there are professions such as firemen and women that are exposed to smoke inhalation. They're getting exposed to cancer earlier. Cancer is just showing up in younger populations, and we wanted to remove those barriers so it makes it easier for you to get screened sooner. You do have to have a letter of medical necessity from your doctor, but it otherwise is covered. Whole health, whole you. It's really our whole point. And so we go above and beyond, and we have health professionals such as nurses, social workers, dietitians, pharmacists, health coaches. We have all of that to really provide an additional extension to go above and beyond just being an insurance carrier. Building healthy families. So whether you're trying to conceive, expecting a baby, raising young children, we have this program available to you. Once you become a member, you can access this through the Sydney app, which I'll talk about in a later slide. So I talked a lot about your medical well-being, but your mental well-being also matters. We have the largest behavioral health network in Massachusetts, but also in the country through Carelon BH, which is formerly Beacon Health Options. You may have heard them. So we also offer the below virtual providers. And the reason for that is it can be really tough to get access to behavioral health providers. A lot of behavioral health providers nowadays are not taking any insurances, so you're having to pay up front and then get reimbursed. Or they just may not specialize in areas like pediatrics or adolescents. So we've offered these for you to use in tandem or in lieu of a BH provider. So Live Health Online, you can connect to a therapist, board certified psychologist, and urgent care medical services almost 24/7. Talkspace, you've probably seen ads, TV ads. This is a convenient online therapy through text and audio, video as well, 24/7. Aspire 365 is a personalized at-home mental health and substance use treatment for people ages 12 and older. So really tough to find people that specialize in that younger population. Aspire 365 is a really great tool. In Stride Health is general behavioral health anxiety and OCD in children and adolescents ages 7 to 22. And then we have Equip, which is evidence-based eating disorder treatments. Digital and virtual care solutions. So Sydney Health, once you become a member, day one, download Sydney Health. You can basically have access to your ID card. So if you lose your ID card, we're going to mail it to all members when you become a member. But if you lose it, leave it at home. All you need to do is pull up your Sydney app, go to the button on the upper right-hand corner, click ID cards, download it, save it to your Apple Wallet. You can send it to your doctor via email because we all know that they love to ask every time you go to the doctor's office, where's your ID card? You can also live chat with member services. You can tap to receive a call back from member services. You can send messages, find doctors, hospitals, etc. You can check your costs for care. You can see what your plan covers. You can find your deductible, copay, and share of costs. So I love it because it gives an interactive tool of where you are with your deductible. So you don't have to call member services just to ask them, have I met my out-of-pocket max, or where am I with my deductible, or what's my copay? You can use the Sydney app for those tools. My Health Dashboard is just another wellness resource once you get into Sydney. I strongly recommend it. It helps with nutrition tracker, wellness trackers, etc. And then removing barriers to access with more virtual care options for members. So 24-hour nurse line. It's available to you to speak to a registered nurse about health concerns anytime, anywhere. So if it's after 6 and your doctor's office is closed, or the weekends, it's not an urgent care visit or need, but you just want to speak to somebody to get advice, next steps, that sort of thing, you can call 24-hour nurse line. And then just keep in mind that we have our telehealth copays are lower than in person. So if you're looking for cost savings and you don't want to spend, $100 for an ER visit, again, if it's an emergency, certainly go. But if it's a cold or, just not sure what's going on, this can offer a more affordable option to you. I know I'm throwing a lot at you in under 30 minutes, but where can you find resources and materials? So if you go to our website, wellpointmass.com, it's your one-stop shop for materials. Everything that I spoke about earlier about comparing Total Choice to Plus to Community Choice to MedSup, you can do that interactively on your own. You can click the plus button and it'll show you all of your out-of-pocket costs, deductibles, all of the information so that you can compare and figure out what plan is best for you. You can also get access to our plan year materials, so our handbooks, our benefit summaries. So if you're looking for specific benefits, IVF or anything, you can do a search and pull up that information to see what that coverage would look like. If you're not sure what providers are going to be tiered, or if you're considering the Plus plan, you can access Find Care and take a look at your provider and see what tier that they would fall in. Who can you contact? So we have a dedicated annual enrollment line. Our team is located locally. You can call the 877-633-6396. They're equipped to answer all of your questions if you have any. You can also contact our commercial member phone number or our Medicare phone number as well. But for now, for annual enrollment, I definitely recommend that the 877 number as well. And then before we go into questions, I did want to just pull this up. This is our snapshot of the hospitals in Massachusetts, just so you can see the robust network, right? So for Total Choice, all of the hospitals have a check mark because there's not a quote unquote network. Plus, going to be the same thing. Most of the providers are going to fall into a tier 1 or tier 2 category. I think we have a handful, maybe 5 or so that fall in that tier 3. And then community choice, you'll see maybe there's about 10 that are considered non-community choice hospitals. But again, as I mentioned, you still have coverage. It's just going to be at the 80/20 coverage level if you, for some reason, do need to see one of the non-community choice hospitals. So I know I said a lot. I will open up the floor to see what questions we have. You're on mute, Claire. You're still on mute.
Okay, can you hear me?
Yes.
Right.
I think you're on mute now still, so I can't hear.
Okay. We had a question.
One of both of you are unmuted. I know that.
You're unmuted?
I am.
Question was about finding out how your doctors would be covered. I know you mentioned that, but is it possible for you to just quickly go to the website to show people how to do the provider search?
Yes, I can do that. Bear with me 1 second while I stop sharing the screen.
Maybe, is there a second question that Elaine could answer while Shayna searches?
I will say there were a handful of questions within the chat that in the Q&A that I did answer. A lot of great questions.
Should we read those questions aloud? If you make them more anonymous?
Okay. So I'm just going to go through and read those questions and answers after.
Looks like we are about to see it.
After this.
Can you see the screen? Oh.
Yeah.
Okay. And it's on the website, correct?
No, it is, yes.
Yes.
Okay, perfect. So you'll go to wellpoint.com/mass. You click Find Care, this blue button here, and it'll bring you to a page that says Find a Doctor, and it'll load. Okay, so once you become a member, you would log in, and it's better to do it when you're logging in because it's more personalized. It pulls you into a lot more information, but you can search as a guest today. So I'm going to go to guest search. And it's been a while since I've done this, so don't mind me. So I'm going to put in a zip code. I'm going to do 021. Should I do 22, Elaine, for like Boston? Okay.
Yes.
And I'm going to just type in, let's do, what's a good hospital? Maybe Boston Children's or Dana-Farber. Okay. Do Boston Children's. Okay. And I guess it's in here the old way, but if you click, you'll see Children's Hospital Boston. And it will search, it'll find, and it'll see here on this right, it'll say tier 2. And it'll give the contact information as well. So if you were to type in a individual doctor, it would function the same way as well. You can also sort by distance. You can sort by name. You can check the accept new patients as well. So there's different filters that you can do while you're in here selecting or looking for a provider.
Great. That seems great. Thanks.
You're welcome.
The next question is, how does the Wellpoint supplemental plan compare to the Blue Cross Medix supplemental plan currently offered?
Great question. I don't know because we're not familiar with that particular supplement plan, so I don't know what they have today or what you have today. But what I would encourage you to do is we have, if you search on our website, Medicare Sup, right? It'll populate all of the like deductible, well, deductible doesn't really apply, but all of the out-of-pocket costs for you to compare what what you have today. If you also have more questions that you're like, I normally pay for this, or this is what my coverage looks like today, call our annual enrollment number, and they can help walk you through the current, what our Wellpoint offering is to help you make that comparison.
Thank you. Next question is, how can I find out if my current medications are covered?
That would be through CVS.
Yes, the person that asked the question asked a couple of times, it came through a couple of times on my end, so I did respond with the phone number for CVS as well as their website from the GIC benefit guide.
So maybe we can read out that phone number? Because I think only the person that asked the question can.
Sure. Give me 1 second. The phone number for CVS Caremark is 1-877-876-7214.
Great.
Thank you. The next question is, will the slides be shared with us so we can send those out?
Happy to. Yes.
Next question is similar to one that was already asked and answered privately, but we can answer this time out loud about living in Vermont and not able to find the local PCP in their area, and how can they find who's covered in that area?
Is it the same search tool on the website?
Yes.
Yes.
So it is the same search tool. No, sorry, I'm getting a little feedback. It confused me. So yes, it is the same search tool. They would go to the Find Care tool, enter their zip code, and then they can search for the type of physicians they're looking for. So if they're looking for a dermatologist, you could type in dermatology, and it would bring up a list of physicians in that area.
Thank you. Next, two related questions is, once you retire, does your spouse have to find their own plan if they are Medicare eligible?
Elaine, do you want to take that?
Isn't that GIC policy?
Yeah, so the way that it works is for the Medicare supplement plan, you can only be one person on that plan. So let's say you're Medicare eligible, retired, qualify for a Medicare plan, supplement plan. If you have a dependent like a spouse or something that's not retired yet or not eligible for Medicare, they would have to go on one of the active Wellpoint plans. So like Total Choice Plus or Community Choice. If they are also eligible for Medicare, they would elect their own Medicare Sup. So you would have to have two different policies, one for spouse one for spouse two.
Thank you. Next question is, what is the difference between a Medicare Advantage plan and a Medicare Supplement plan?
Oh,
So we have,
Yeah, go ahead, Elaine.
I was going to say, we have Medicare supplement plans. So we cover after Medicare, who is primary, makes their payment. And then we will cover, or we will consider the charges even if Medicare does not cover the service.
so it's hard to answer that question because it's actually Medicare rules that govern.
So yes and no. So if Medicare covers a service, then we pay secondary to what Medicare pays. If Medicare doesn't cover a service such as hearing aids, for instance, Medicare has no coverage for hearing aids. We cover hearing aids under our plan as the primary payer. And there are other services that Medicare does not cover as well that we would also consider.
And an Advantage plan, which WellPoint doesn't have. I mean, I can't speak to sort of how the Advantage plans work, but essentially it's not a supplement plan. So it essentially takes over instead of Medicare, right? So it's like you wouldn't you could get Medicare and Medicare Advantage, but usually most people do Medicare and then a supplement.
Thank you. Next question is, we live in Florida and did a search for a primary provider, and it shows one provider within 100 miles. I'm sorry, they say no providers within 100 miles.
Okay. So in Florida, we do have a network that we use. I would recommend, if it's not coming up on the tool, at that point, I would recommend calling our customer service line. And the reason is they can check. We have a RAC network for out of state providers. So they should be able to do a better search to see if anything else comes up, just to see. I'm not sure where you live or if it's a rural area, but I would recommend contacting member services.
And just to piggyback off of that, physicians, although they are a primary care provider, sometimes they'll be listed as family medicine, general practices. They don't, they're not always listed as a primary care provider. It just depends on how their medical licenses is configured.
Thank you. The next question is, would you repeat the annual enrollment number? Did you give a phone number earlier? Is that they might be referring?
I did, yes. Well, we can put it in the chat. It's 877-633-6396.
Thank you. I'm going to just repeat some of the earlier questions that were answered privately by you, Elaine. None of my providers in Vermont know who Wellpoint is, even if I tell them about the relationship with Anthem and Blue Cross. And Elaine's answer was, in Vermont, we use the Private Healthcare Systems Network, PHCS. So that might be something to try with a physician in Vermont who has not heard of Wellpoint.
And when you get your member ID card, it will say that on the back. So like if you live in Vermont, for example, we mail you a specific card that has that PHCS information and logo on the back of the card.
Are there any questions for anyone in the room who doesn't have this capability to type these questions in that we're reading?
I guess the only one, so I'll be the retiree. My husband's retired, so say like next year, if he wanted his own separate plan, could he do that, or does he have to do it when I'm signing up this year?
Do you want to take that, or do you?
Could you hear the question, I guess, first?
Yeah, I didn't hear the question, the full question.
So I'm in the school system. I'm going to be the retiree, and I'll have my own plan through Wellpoint. My husband is already retired, and does he have to sign up the same time I'm signing up this year, or could he sign up next year when it's the annual renewal sign up? How would that work?
Is your husband employed through the same, would he be eligible through the GIC, or is it outside of the GIC?
Outside, because he didn't, he worked for a private business and then worked in the school system for 7 years, and then he retired. So he has Medicare, and then the supplemental part is through Blue Cross Blue Shield right now.
Okay.
So I didn't know if, because I know it's two separate plans, but I didn't know if he had to sign up when I'm signing up as a new member, or he could wait a year.
No, it sounds like his annual enrollment, his open enrollment would fall under the Medicare, the traditional Medicare open enrollment, which I believe occurs in November, since he's not eligible for any of the GIC Medicare supplement plans, for example. So it sounds like it would be different because you guys have different
So he would actually have to sign up in April and then drop his plan that he's on right now, which normally would be open enrollment in November. I guess it gets kind of weird.
Because you're on a fiscal year start and he's on a calendar year start? Does that make sense then? When does he sign up if it's a 6-month start difference?
So I think what may make sense for this particular one, we can maybe take your specific, I think, question, and maybe if Claire can put me in contact with you or send your contact information, we can try to help you navigate how that would look. Because I think it's a little different because you're kind of coming through the GIC and he's not. So it sounds like there's a little bit of difference in annual enrollment and coverage as well. So we can work with you separately to help you navigate through that if you'd like that.
Okay, that sounds great. And I'll get that contact information before you go. So, yeah. Thank you very much for your time and taking all these questions. And I think it's time to welcome the next presenter.
Right.
So thanks very much, Shana and Elaine.
Thank you.
Take care. Thank you, everyone. Bye-bye.
Bye.